A couple of days ago, Governor Gordon Obaseki decried corruption in the healthcare sector by doctors in Edo State. And he came out really, really strict because he was stating that most doctors, they don't come, they don't show up, they don't turn up for work. And, he came out with a policy that no work, no pay. And everyone saw that that was really commendable because the healthcare system is really falling. We need doctors to be available. We need them to be available because what was going on is like some of these doctors, they have their own private establishment, their own private care, private hospitals. That is where they are normally present. They are not present in the hospitals where they are meant to be. And as a result of that, the report got to the governor and he decried all of those activities. But surprisingly, right now, resident doctors, they've actually debunked Obaseki's allegation of corruption in the healthcare sector. Who is lying? Who is telling the truth? We'll find out in a moment. But before we do, guys, please don't forget to like, share, and to subscribe. Thank you once again. The Association of Resident Doctors, ARD, Edo State Hospital Management Board chapter, has debunked corruption allegation against doctors in employment of the state government made by Governor Gordon Obaseki. Obaseki had on Monday flared a high level of corruption in the healthcare system in the state, noting that his administration would insist on a new order and that doctors must render services to Edo people to justify their salaries. He made the submission during a meeting with doctors drawn from the State Hospital Management Board, Edo Specialist Hospital, Edo Primary Healthcare Agency, and the Ministry of Health at Government House in Benin City. The governor said his administration will vehemently resist the old order and chart a new course to improve the healthcare system in the state, noting that the meeting with the doctors was to discuss the way forward for the healthcare system in Edo State. But the ARD, in a statement signed by Dr. Osayede Edori Siagbo and Dr. Ovagbele Aiboy, President and Secretary General respectively, after an emergency meeting of its members, described Obaseki's comment as vexatious and unsubstantiated. It said they were unaware of any independent panel set up by the government where any doctor was indicted for any form of financial impropriety, adding that if such an investigative body was ever set up, we challenge the government to make its findings public. It is a notorious fact that several years ago, the Edo State government introduced a direct mode of collection of revenue for services rendered in all government health facilities that effectively makes it possible for the management of these health institutions to have access to the collected revenue, let alone the doctors who render only clinical services. Any lapse in the government revenue collection process must not be blamed on any medical personnel. We are, however, aware that the entire 34 hospitals under the Edo State Hospital Management Board survive on a paltry monthly subvention of about 15 million naira and are able to still generate substantial revenue that is collected directly by the state government. Commenting on the issue of private practice by doctors in government employment, the doctor drew the governor's attention to that fact that there is an existing law, regulated and other professions, Private Practice Prohibition Decree number 1 of 1992, regulating private practice by medical doctors in public service, which exempt doctors from the ban of public officials from private practice. They added that the 2008 Code of Medical Ethics in Nigeria, Part E 49, states that medical and dental practitioners who were in full-time employment in the public service in Nigeria were free to employ their spare time and unofficial hours to engage in private medical or dental practice. It is therefore disingenuous to attempt to criminalize and demonize our hardworking doctors whose practice does not conflict with the code of conduct for public officials, as they are even already working more than the period required by law. If it is even true that doctors own private clinics, Central Hospital, Benin City is an unlikely place for patient recruitment, as only indigent patients who cannot afford the cost of treatment in private and federal healthcare institutions patronize the hospital, the statement said. The ARD, while denying refusal to be posted outside Benin City, noted that the shortage of skilled health workforce meant that a limited number of doctors have to attend to hundreds of patients daily, and it should be known that quality healthcare could not be rushed. It is true that there is an unacceptable disproportionate distribution of doctors between the rural and urban areas in Edo State when you consider that the main urban areas of Benin and Ekpoma axis have UBTH, Central Hospital, Stella Obasanjo Hospital, Ira Specialist Teaching Hospital, and several private hospitals between them. The association has, over the years, shouted itself hoarse on the need of the state government to employ or engage the services of more doctors due to the acute and now chronic shortage of manpower. During Mr. Governor Obaseki's first tenure in office, there was a promise to employ about 6,000 workers in the health sector, including doctors, in order to ameliorate the shortage of manpower in the system. We are, however, shocked at the statement credited to the governor, which tends to create the impression that there are too many doctors in Central Hospital, Benin City, doing nothing, even when the employment is yet to be done. His Excellency may not be aware that the supposed overbloated medical workforce consists of about 50 first-line doctors called in term or house officers who are on a mandatory one-year internship under supervision in line with the Medical and Dental Council of Nigeria MDCN regulation. These categories of doctors cannot be posted to hospitals outside Benin, rural areas, as they lack the specialist medical personnel to supervise and train these interns. Doctors in Central Hospital Benin are overworked, overused, and under-remunerated. The Department of Family Medicine, for example, has only 3 consultants, 6 senior registrars, and 6 registrars who attend to about 4,000 patients on a monthly basis. This is the same scenario in the Department of Obstetrics and Gynecology and other departments in the hospital. The Association of Resident Doctors also noted that with dismay that the governor was giving a guided tour around Stella Obasanjo Hospital last weekend by Chief Medical Director of a federal teaching hospital in the presence of the medical director of that hospital alongside the permanent secretary overseeing the hospital, describing it as very unfortunate that the doctors from the federal health institution in the state are contracted to head and give instructions to state doctors of the same qualifications and trainings. This is not only demeaning to our doctors, but also an avenue for wastage of funds, it said. The ARD noted that its members are averse to being posted to the rural areas of the state. It, however, added that for the healthcare system to run efficiently, certain necessary medical equipment and facilities must be put in place as basic radiological and histological investigative tools are presently lacking. Our members are ready and willing to be posted to any part of the state. However, the governor should also put every necessary infrastructure, such as adequate medical facilities and equipment, power supply, quarters for accommodation, and adequate security in place so that people in the rural areas can also access quality healthcare services. There's an urgent need for the rebuilding of the more than 100-year-old dilapidated Central Hospital building to make it befitting of a hospital setting. There's an urgent need for the employment of more doctors, consultants, and medical officers, as well as other healthcare personnel to render healthcare services to the citizens of the state. The current situation stifles any plan by the state towards universal health coverage, UHC, if not addressed. Providing adequate access to care for the entire population of the state will require enough professional hands, both in rural and urban areas, ARD said. Guys, we've heard it all. Doctors have debunked all of the allegations of corruptions made by Governor Godwin Obaseki in the healthcare sector. I really don't know who's lying or who's telling the truth, but you guys heard it all. Let's hear your take down below in the comment section, and those that live in Edo State as well. Let's hear what you think, because definitely you would have first-hand experience. Thank you once again, guys, for staying tuned. Please don't forget to like, share, and to subscribe. Till I come your way again with more updates. Bye for now, and God bless.